Hello, my name is Juan Duarte, and in this video I'm going to go ahead and demonstrate and show how to do 3 types of injections: an intramuscular, intradermal, and subcutaneous. I'm going to go ahead and start out with the intradermal injection, and I'm going to be needing a syringe, 27 gauge by 1/2 inch needle, a cotton ball, and an alcohol wipe. Now I've already gone ahead and washed my hands, my mouth filled up, and I have my face mask on. And I've also gone ahead and verified with the physician the proper dosage and medication that will be needed. Now I'm going to go ahead and verify the patient. Tiffany Duarte,
Yes,
can you please go ahead and verify my date of birth?
February 3rd, 1999.
Okay, perfect. And now I'm going to go ahead and ask the patient to place her forearm on the table, flat. Now I'm going to go ahead and get my 4 fingers, place them away from the elbow, away from the wrist, and away from the hairline, and making sure that once I pick my site, that's not on a vein or near a vein. And now that I have my site picked, I'm going to get my alcohol wipe, and I'm going to go ahead and wipe off any area, the area, get rid of any bacteria that's on the skin. Okay, and now I'm going to go ahead and get my syringe, make sure that's tight, and the medication in here is already at 0.1. I'm going to take the cap off. Okay, now I'm going to be placing the needle with the bevel up at a 10 or 15 degree angle. I'm going to go ahead and tuck the skin. Okay, inject. Now that the medication is already in there, I'm going to go ahead and make sure that take the needle out and place the syringe in a biohazard box. And I'm going to go ahead and wipe off any what's coming out. And once that is done, it's very important to make sure you tell your patient to not touch or scratch the area at all. And also making sure to document this on the patient's chart. And that's it for the intradermal injection procedure. Now I'm going to go ahead and start off and go ahead and do the subcutaneous injection. And for that one, I'm going to need the patient to stand up. Please roll over your seat. Again, I've gone ahead and washed my hands, I'm all gloved up, and I have my face mask on. And I've also gone ahead and verified with the physician the medication and dosage needed. And the instruments needed for this video is a 25 gauge by 5.758 of a needle, a band-aid, an alcohol wipe, and a cotton ball if necessary. So for the subcutaneous injection, to look for the site, it's always behind the arm, above the triceps, on the adipose tissue. Now that I have my site, I'm going to go ahead and get my alcohol wipe. And wipe the skin from a small circle to large. Get rid of any bacteria that's on her skin. Once that's done, I'm going to go ahead with my syringe, make sure it's tight, get the medication. Go ahead and at 0.5 measurement. Perfect. I'm gonna go ahead and flick off any air bubble that's in the syringe. Once that's gone, I'm gonna go ahead and make sure to place that the level is up, and to place the syringe at a 45 degree angle. Cotton ball course between the fingers. Okay. Level up, 45 degree angle. Okay. Inject. And also it's important to make sure when you're injecting to pull out to make sure you didn't get the vein, and if you see there's no blood coming in the syringe, then you go ahead and inject the medication inside. Want that in there. Put your cotton ball. Allow cotton ball. Rub the area. And place the syringe in the biohazard box. Cotton ball. And get your band-aid. Place it on the infected area. Also make sure to document this in the patient's chart, and that's it for a subcutaneous injection. And now I'm going to go ahead and demonstrate how to do the intramuscular injection. And again, the patient standing up, which is great. Now I'm going to go ahead and verify the patient. Captain Dorte?
Yes.
Can you go ahead and please verify me your date of birth?
February 3rd, 1999.
Okay, perfect. Now this injection is given on the deltoid, and I've already gone ahead and verified with the physician the medication and dosage that will be needed. And also, sorry, and my band-aid, my 23 gauge by 1 inch needle, and cotton ball and alcohol wipe. Now, the way you measure this is placing 4 fingers above the chromium process, above the shoulder, down to the deltoid, and once you have your site picked, you're going to get your alcohol wipe, wipe the area from small to large, place that there. You're going to go ahead and get syringe, at 0.5. Perfect. Pick up any air bubbles in the syringe. Now that's done. Take my cotton ball, place it between my fingers to use after. Take off the syringe. I'm going to go ahead and have the syringe, hold it at a 95-degree angle with the bevel up. I'm going to go ahead and make sure that the site is cleared off from the alcohol. Pinch, bevel up, 95-degree angle, inject, and pull out. Make sure that there's no blood coming out. Perfect. Then you go ahead and inject in the medication. Once that's done, you're going to go ahead and control. Place this in the biohazard box. Get your cotton ball and rub the area. And then after that, get your band-aid. Third. And after that, make sure to document that in the patient's chart. And that's it. So I've gone ahead and demonstrated how to do an intramuscular injection, intradermal, and a subcutaneous injections. And this concludes the video. Thank you.